Last week, the Green Mountain Care Board took a regulatory action that should help Vermont's physicians with the consent policy for enrolling into the information exchange and see information about their patients from other hospitals and other physician practices. This action by the Green Mountain Care Board was initiated by the VMS last October and will significantly simplify the patient consent policy. Previously, the patient would have to provide consent to every participating healthcare provider. The change makes it a single consent for all providers to access the information on the exchange network. This exchange network should go into implementation this May. VMS feels that this change in the consent policy will make it much less administratively burdened for physicians and much less confusing for your patients.
VMS and the Department of Health have fought off bills setting the standard of care for Lyme disease for about 6 years. This year, again, a bill was introduced that created licensing board immunity for prescribing long-term antibiotics for treatment of Lyme disease, and also created an insurance mandate requiring coverage of long-term antibiotics. The bill that passed the House, however, did not include these two provisions. Instead, it required the Board of Medical Practice to create a policy that the board will not take disciplinary action solely on the basis of providing care to patients with Lyme disease consistent with the guidelines, including the ILADS guidelines, which are the only guidelines that provide some support for treating Lyme with long-term antibiotics. VMS continues to oppose the bill, but believes the version passed by the House is much improved.
The House of Representatives passed Bill H-217, which is a bill that would tighten up the laws regarding smoking in workplaces and public places. And in a last-minute amendment added H-70, which the Vermont Medical Society has been supportive of, which would ban smoking in vehicles with minors. Unfortunately, the amendment only included those in car seats. But it's a start, and we're happy that it actually lived to see another day. If the bill hadn't been put into, if H-70 hadn't been put into H-217, the bill would have died and would have had to be reintroduced next year. So we're looking forward to that moving on to the Senate, and will most likely be taken up in Senate Health and Welfare.